So we're going to expound a little bit on what Mike's talked about and go into a little bit more about what we actually do after someone has a concussion. I'm going to do finger puppets. Did you see it? All right. I know this is a soccer group, but it's my son. He's cute, isn't he? So I have to include that in every presentation. First slide, please. Okay, next one. Thank you. Just to reiterate, Mike talked about what a concussion is. I have this slide up here for one reason, the second line. But a concussion, the way I say it to patients every day, is any blow or force to the head that causes changes in mental status. Mental status means confusion, disorientation, memory loss, that foggy in the head feeling kids will talk about. I see kids from little guys all the way up to the pros, and even the little guys are able to talk about that foggy in the head feeling, just not feeling right. The reason I had this down here is it says trauma-induced alteration in mental status that may or may not involve a loss of consciousness. You do not need to be knocked out to have a concussion. I can't say that enough. About 9 or 10% of concussions actually resulting in loss of consciousness. But we still hear that. I know, Mike, we still hear that. People are being told, oh, he didn't have a concussion because he wasn't knocked out. Okay? This American Academy of Neurology guidelines is changed from 1997. So it's a well-established guideline. So if that's your mindset, you need to change it. Okay, next slide, please. All right, this you can't see. I don't know why. The reason I had this slide up, Mike went through the 4 symptoms, but one of the things I wanted you to explain is whenever you're hearing about concussions or reading about concussions, you'll often hear the phrase signs and symptoms. And what you can't see is on one side, on the top is this side, the left side is signs, the right side is symptoms. The difference is signs are things that other people observe in a patient. Symptoms are the things they report themselves, all right? And as parents, what you need to be looking for is the signs, okay? So when a kid takes a good hit, oh, thank you. When a kid takes a hit, these are the things as a parent, as a coach, as a teammate that people should be looking for. Moving clumsily is one of the big things. Balance disturbance is very common after concussion, and we see kids who are wobbly, okay? Soccer and hockey in particular, you see kids who are just wobbling as they're trying to walk off the field, off the ice. So that's a good sign. Look confused, forget instructions, answer questions slowly. You ask them a question, they're staring at you, slow to respond. It's a good indication. I do also really want to talk about this mood and behavioral change that Mike talked about. He's right, irritability is often something that will continue. I hear from parents all the time. She's more irritable than normal for a 15-year-old girl, but immediately after the concussion, we can see some dramatic personality changes, some mood changes. And we will see sometimes real anger. They're just really agitated. I see all the athletes from Northwestern University as well. Had a kid who missed a tackle because he was concussed. The coach yelled at him. He turned around and swore at the coach. It was a very nice young man, and the ATC knew right then something was wrong because it was very unlikely for him. So he pulled him from the game. We can get kids who are really silly. If you get suddenly a kid just acting strange, it may be part of a concussion. And we also get kids who are very tearful. I've had pro athletes, I won't name names, who were, crying on the sidelines because there's this emotional discontrol is what we see in concussion. So that's one of the things that you can see and teammates should be seeing. We do have cases where teammates are saying, coach, something's not right with Johnny. He's acting a little odd, okay? Again, symptoms are the things that they will report that Mike talked about. Next slide, please. Okay, just to reiterate what Mike talked about, again, as of last year, this is now the law, right? So if any of the athletes show any signs of concussion or reporting the symptoms, now you know what that means, they have to be removed from play. And the point of that was it's really such a good thing on so many levels because as a coach, how do you know when to pull a kid from play? Well, that decision's been taken out of your hands. If they have any of those symptoms, any of those signs, they're done, okay? Does that mean they had a concussion? No, that's not your job to make the distinction. If they have athletic trainers available or physicians available, they will make the determination. But the idea is to remove them from play just in case. And also sometimes what we see is kids will have a hit and they'll have some minor symptoms and they'll say, I'm fine, but you're seeing some indications of symptoms. What can happen sometimes is those kids will develop symptoms later. So it's protective as well to remove them from play initially. And they cannot be returned back to play until they've been cleared by an appropriate healthcare provider. Meaning their parent can't say, I'm going to give them clearance. You have to go see their pediatrician, or the athletic trainer can clear them. So it's good law. There's not a lot of, obviously it's not being policed well. I mean, you're not going to have concussion caps on the sidelines of games, okay? But it is a law, and it is something that it's done to protect kids. Okay, next slide, please. All right, so now we know what concussion looks like. What do we do with a concussion after we have a kid who's concussed? All right, rest. I tell people all day long, there is no magic bullet for concussion. It is simply a rest. Mike Tarcher showed you that slide with all the curves, all right? Basically, like you said, what happens is the brain is asking for extra energy to heal these changes, these neurochemical changes. At the same time, it's getting less. Concussion is ultimately an energy crisis. So we just rest them, all right? And that means keeping them home for school a couple days from out of practice. I tell to parents all the time, give me 2 days. Just keep them home from school. If you've all been in a school, just stand in a hallway of a high school or a junior high, okay? It's loud, it's chaotic. And what happens is kids are in that environment and they're picking all the sight, the sounds. That's work to the brain. These lights are work to the brain, hearing things. So what happens is kids go to school, they're completely overwhelmed by noise, and then we ask them to sit in a class and try to take in what the teachers are telling them. They're not getting it. They're not benefiting from that anyways. Kids tell me all the time, how was Monday? How was school? I was there in body, but not in mind. Okay, what are we doing? Okay, so they go to school for an hour, and then their headache increases significantly. Then they're in their nurse's office. Okay, this is a big issue for school nurses. We get a lot of calls from school nurses because they're dealing with these kids who are coming with significant headaches and other symptoms. Keep them home for rest for a couple days from school. It's the same thing for coaches. If there's any coaches in here, I understand that for a lot of teams, if you are injured, you should still be at the practice. Fine for a sprained ankle. If you have a concussion, you're slowing down the healing process. Kids, these kids, they're not passive. They're on the sidelines, they're shagging balls, they're walking up and down the field, they're yelling at their teammates about what they're doing wrong, right? Okay, that is almost as stimulating as being in the practice. So keep them home and let them rest. Okay, soccer particularly, they're outside in the sun, they're hearing the whistles, everything. All right, it's slowing down the healing process. All right, what that does not mean is complete isolation. The research is really supportive that right after an injury, for the first 3 or 4 days, kids do better, adults do better when they just limit their exertion. But that doesn't mean we have to do nothing. We're getting all kinds of crazy recommendations out there. I had a case around Christmas time where the parent was told by the ER doc, must go home and turn off every single light in the house. There must be no light at all. So she said, okay, called home and told her husband, and got home and said her 4 other children were all sitting around the kitchen table like, what do we do now? And she was trying to put Christmas decorations in the dark. Okay, that doesn't make any sense, all right? It's not complete isolation. It's just reducing stimulation. I actually don't take phones away from kids. I know it's like ripping their souls out to take away their texting, all right? So I don't do it. But we say, lower the volume on the TV. What do you expect them to do for a couple days? Stare at the wall, okay? So let them watch TV, limit, lower the volume, try to close the drapes. Just try to get them to sleep as much as you can, all right? That's the idea. Just keep them rested, all right? And it doesn't also mean that we need to be, if you're getting a kid who has symptoms that are lingering, and all of a sudden now the doctor's pulling them out of school and telling them they have to go sit in a dark room for 4 days, after that initial recovery period, that's actually counterproductive. Okay, it doesn't help the brain 6 weeks after an injury to suddenly now be reducing stimulation. It's something else going on if they're still symptomatic. All right, so monitoring of physical symptoms. Mike showed you the recovery curve, all right, that slide. Basically, all right, what the research has shown is that in a typical concussion, the brain goes back to homeostasis, back to normal in about 7 to 10 days. That's a benchmark, right, on average. So there are some people who legitimately are feeling good after 3 or 4 days, okay? Some people will take 2 to 3 weeks to get longer. The range of what's normal in recovery is actually pretty broad. But we give you that benchmark, just a general idea, all right? So, and your kid's age, about a week or so, sometimes 2 weeks. There's a lot of factors that will contribute to that. Obviously, the severity of the injury makes a difference. If someone has a very mild concussion, they're more likely to recover more quickly versus a more severe injury. The age makes a difference. We know that high school athletes and grade school athletes take a little bit longer to recover than collegiate athletes or adults. Okay, the developing brain takes a little bit longer. Again, we're talking days, not weeks. So statistically, it's a little bit longer. Girls take a little bit longer to recover than boys. There's a couple of theories as to why. And the theory that's getting the most play is that it may be a neck musculature issue. If you have a stronger neck, when your head gets hit, there's less movement of the head, so therefore less of an impact to the brain. It's still theoretical at this point, but statistically, girls will take a little bit longer. If you have a child who has a history of attention deficit disorder or a learning disability, they also tend to recover a little bit slower. You need to be a little bit more conservative with those kids. So there's a number of factors why some kid may feel good after 3 or 4 days, and some kids are still symptomatic after 2 weeks. Okay, but after about 2 or 3 weeks, if a kid is still symptomatic, then we start looking at, are there other physical injuries that are contributing, all right? And that's a whole other thing, but dizziness is one of the most common things that we see. When we send people out for physical therapy, to what we call vestibular therapy, to address those issues. Sometimes we look at, they may be having persistent headaches because of neck injuries, not the concussion, but the neck, okay? People can be having post-concussion migraines that are not just post-concussion headaches. So we start looking at things beyond just a concussion. So if you have a kid and they're still symptomatic after 3 or 4 weeks and your primary care doctor pediatrician is saying just wait, you need to see somebody else, okay? Because when their symptoms are persisting, there's something else going on. You need to start examining what may be there. Also, we make a lot of academic accommodations. I write these letters all day long during the school year because kids are going back to school before they're going back to play, and we need to be addressing those issues. So oftentimes, I simply will say, no test, homework, or quizzes for the first 1 to 2 weeks, because what we don't want is we don't want kids, their grades dropping off. Okay, it's not fair. I like to remind schools that they're often being times injured while they're playing a sport for them. Okay? But we also know what happens is kids will go to school and they come home and they're really wiped out and they have a hard time doing their homework, so it takes them a lot longer. And then what happens is they're up all night trying to do their homework, which is completely counterproductive of what we're trying to do. So we say no homework or quizzes during this time. They have to make it up. It's not a free pass. I always say it. I have every kid in my office at finals time if that was the case. But we do give those temporary accommodations. Sometimes we have more involved complications for those kids that are slow to recover and have persistent symptoms. But there's lots of things that we can do, and I can tell you the schools have really come around. I've been doing this about 15, 16 years, and I used to fight with schools all the time. Not anymore. Schools are really good about making academic accommodations for concussed kids. Next slide, please. All right. Now, so what about the return to play? These are international guidelines. Every 3 or 4 years, there's an international conference for all the experts in the world on concussion. And this was the most recent one. There's another one coming up this November. But basically, the idea is for any kid to go back to play, they must be asymptomatic. That means without symptoms, at rest and with exertion. Okay, so what does that mean? They need to be without any physical symptoms or cognitive symptoms. So physically, they need to feel good. Subjectively, they have to say, I feel like myself. Okay, good old Johnny. So, and the problem with that, obviously, is that is, subjective, and they can lie to you. Okay, athletes lie to us. I know that's shocking for all you parents in the room. Those of us who do this work will say, and we all agree, it's kind of funny, it's universal, girl soccer players are the worst liars of the group. They will lie right to your face. I don't know what it is about girl soccer players, but I said they're just tough, and they are the worst ones for lying to us. But and they're most anxious to get back. So the reason why we don't just anymore take their opinions is because they do lie to us. But also, sometimes kids subjectively really do feel good, but cognitively still have some symptoms. So you need to address both. And that's why neuropsychologists, we test cognition. We look at memory, attention, what we call information processing speed. That's how quickly do you process information. Take it in, make a decision, and respond. Really key in sports. So what we do is we look at to see, are there any evidence of any residual problems? So if somebody subjectively feels good, cognitively looks good, then we start them through a stepwise exertional protocol. And I always say to parents, this is sort of a checks and balance system, because with each increasing level of exertion, you want to make sure that symptoms don't return. So we get them to start up a little bit of aerobic activity. I prefer a stationary bike versus a treadmill. You get kids who get dizzy and fall off the back of a treadmill. Okay, it's also a little jarring on the neck if they're having any neck issues. If they don't have any symptoms with some mild, limited aerobic activity, they can go to the next step. If they do have symptoms, that just means they're not ready, and they'll rest a couple more days. If they don't have symptoms, the next thing is more intensive aerobic activity. You really want to get them to get a good sweat. Just like they would during a game, you want them to really get their heart rate up. If that doesn't cause a return of symptoms, the next step is agility movements. And that means moving the head, because, sports are not just treadmill, right? They're not just straight ahead. It's lots of movement of the head. And for some kids, particularly kids who have dizziness, when they start to move their head, the dizziness will come back. So we need to do some agility movements to make sure that isn't a problem. The next thing we do is we say sport-specific movement. So we want them out there. We want them out in the sun. We want them with their teammates. We want them in the noise, but no contact. So obviously in soccer, no heading, right? If that doesn't cause return to symptoms, they go back to full practice with contact. If that doesn't cause return to symptoms, then they are then cleared to play. This is typically, there's a day in between each step. It doesn't have to be that way. I often tell coaches and athletic trainers, if you want to combine the aerobic activity with the agility movements, that's fine. Some sports, like baseball, we don't have contact, so we can skip the with contact stage. So it doesn't have to be 5 days, but it gives you an idea that you're increasing that level of exertion to monitor it. And I tell every parent, can I tell you that every kid who gets that last step is 100% cured? I can't. We have no way of looking into the brain and knowing for sure when someone's fully recovered. This is the state of the science. This is the exact same protocol I use with the Bears and the Blackhawks, and no different. But this gives you an idea. It's not just about asking a kid how you're feeling. And for all you who have teenage boys, you're going to get monosyllabic answers anyways. How you feeling? Good, right? Fine. I see teenage boys all day long, all right? So that's not enough anymore. We really need to assess them physically, cognitively, and giving them exertional protocol. Okay, next slide, please. All right, for now, there are lots and lots and lots of information on the internet on concussion, and most of it is inaccurate. If you Google concussion, you'll get more than, I think last time I checked, 300 million hits. Okay, not particularly helpful as a parent to try to, wade through all this. So I would recommend the CDC website. CDC has done a great job of putting together a good, scientifically sound information. They update it regularly. It's cdc.gov/concussion. Okay, really good information. And lots of resources there. They have free programs. The Heads Up program has information that you can order for free. That's for parents, for coaches, for teachers, for players. So it's a great resource. So I strongly recommend if you have you want some other information to go there. Okay, next slide. This is just to give you a heads up. Midwest Center for Concussion Care is my clinic that's now part of the North Shore Network as of Monday. So that's why you're seeing that logo versus North Shore. But a step ahead is a joint venture by the Blackhawks, AHI, which is the governing body of amateur hockey, Athletico, and my clinic. And what we did was paid for free baseline testing and educational materials for youth hockey. And we are in the process, we are doing a similar program with IYSA for their ODP program. And if we don't mess that up, if we don't screw up that, they're looking to do a bigger program. but there are 75,000 kids in IYSA, so we're starting small with the ODP program, which is about 900 kids. But the idea is there is a lot of free, good, solid information out there for parents to feel armed. I understand that you're all overwhelmed by this. What you see in the media is all doom and gloom, but I really, really want to stress to you that kids recover from concussion, okay? In about 1 to 2 weeks, the vast majority of kids are fine, back to normal, back to sports, back to play, and they're back to being your kids, okay? The media has portrayed it in a very different light because that sells and it makes it exciting, but the reality is it's not the case. Kids do well, they recover. I'm a big proponent of sports. People ask me all the time if I would let my kids play football. I have 2 boys, and my answer is always yes. Sports are good for kids. And we want to honor the benefit of sports to kids. We just want to make sure that we're monitoring these injuries and managing them appropriately when they happen, because they happen. And they happen a lot in soccer. Okay, soccer has this much lower concussion rate than football, so it's an issue. Okay, I think that's the last slide.